diabetes, or in other words hyperglycemia. So today we are going to see the diabetes, the types of diabetes, and the other health risk of the diabetes. Now what is diabetes? Diabetes is a chronic that is long lasting health condition that affects your body, how your body produce energy from the food you consume. So body breaks down most of the food you eat into sugar, in other words glucose. So that release that glucose into the bloodstream. When blood sugar goes up, it signals your pancreas to release insulin. Now insulin acts like a key to let the blood sugar into your body cells for use as an energy. Now with diabetes there are two problems. First, your body doesn't produce enough insulin. The second is your body cannot utilize insulin well as it should supposed to. So when there is not enough insulin, or second, when the cells are not responding to the insulin, too much sugar stays in your bloodstream. That is called as a hyperglycemia issue. Over time it increases serious health problems like heart disease, vision loss, and even the kidney disease. Now what is the cure for diabetes? As per today there is no cure for diabetes, but always you can prevent or maintain it by losing weight, eating healthy food, and exercise. Exercise is being active. Now there are three types of diabetes: type 1, type 2, and gestational diabetes. Now, well, first we'll see the type 1 diabetes. The type 1 diabetes is caused by the autoimmune disease. Autoimmune disease is the body attacks on the beta cells of pancreas by mistake. So this reaction stops your body from making enough insulin. Fortunately, only 5 to 10% of the patients with diabetes have type 1 kind of diabetes, and these patients require insulin on daily basis to survive. Type 1 diabetes often develops rapidly and quickly. Second is type 2 diabetes. In type 2 diabetes, body does not utilize insulin well and cannot keep the blood sugar at normal level. This is a lifestyle related type diabetes where 90 to 95% of patients have type 2 diabetes. It develops over many years and can be prevented by keeping the BMI under control, healthy food habits, and regular exercises. Now coming back to the gestational diabetes, it develops in the pregnant woman who never had diabetes in their life before. The risk factors are baby could be at the higher risk of health problems like obesity or developing diabetes in the future. It goes away after the baby is born, but it increases the risk of developing type 2 diabetes in the woman later in the life. Let me know what you want to discuss in the coming video on diabetes.